Let's talk about breast reductions. Hi, I'm Dr. Pirko. Welcome to Ideal Plastic Surgery. Today we are going to talk about breast reductions. Did you know that breast reductions are one of those surgeries that have the highest percentage of satisfaction? It's because most patients don't only just feel like they look nicer and are able to wear the clothes that they always wanted to wear, but they also feel that they feel better. Because let's face it, those patients who want very big, heavy breasts oftentimes don't know what they're signing up for. Big, heavy breasts are making things harder. It's harder to exercise. You oftentimes can have discomfort in the straps of the bra. I don't need to tell you, there's a reason why you're here. So let's talk about the surgery itself. The operation is an operation we do under general anesthesia. You're not going to feel any pain. It takes about an hour and a half, sometimes 2 hours, and we focus on removing the fullness in the areas where you don't want it. Most people still want a little bit of cleavage, so we try not to remove anything superiorly or centrally, but we don't like side boobs and we don't like axillary folds. So this is where we are very aggressive about removing the weight. Our intention is to preserve your ability to breastfeed if you are a young person who still wants to do so, and to reduce the breast volume to a size that is more aligned with your wishes and your looks. We can go quite small if you really want it, but we cannot make everyone into a very, very small person on top because we have to be respectful of the blood supply. Think of a breast reduction and of the breast and the nipple like you would think of a hill that has a plant on top, the nipple. If you ask somebody to remove parts of the hill to make the hill smaller, you're also removing some of the roots of the plant. And if you are too aggressive, you could actually end up with a dead plant. And we do not want to have a nipple loss. So we have to be careful and do only the reduction aggressively in those areas where we can do so safely. But we have to be a little bit more conservative and leave a little bit more tissue behind in other areas where the blood supply is coming through. I think you're going to love the results. Most patients after a breast reduction tell me, why didn't I do this sooner? The surgery itself takes an hour and a half. You get to go home in the same day, and most patients are going to take 1 week, maybe 2 off work, depending on whether you have a very physical job or not. To go back to the gym and jump around and do all sorts of vigorous activity, you might want to take 4 to 6 weeks, but most people go back to work after a week. With breast reductions, our goal is to give you something that you will love, both in terms of size and shape. One of the big advantages is that heavy breasts tend to really go down because of gravity, and as we make the breasts smaller, we always lift them. So you're going to have a much perkier result that is going to be less likely to come down again with gravity than a heavy breast would. We are going to have a result that is going to vary depending on your anatomy, and we'll be able to explain exactly what we're able to achieve when we do your physical exam. But in any way, I am confident that you're going to love the results because this is just one of those surgeries where everybody is happy afterwards. The postoperative care after a breast reduction is pretty straightforward. We don't want anything rubbing against the sutures, so we try to avoid any kind of bra that is going to have an underwire or be very, very tight. Wear some sort of loose-fitting bra. We are going to give you bras here for right after surgery at the time of your surgery, and then afterwards you can wear maybe a sports bra or something that's not going to dig into your incisions while they are healing. They really need to be tenderly cared for the first 2 weeks. Avoid any big pressure on that area. Sleep face up, don't put the weight of your body on them, and avoid any aggressive contact to that area for the first 3 weeks. After that, you can go back to your normal life and activities, and you're gonna feel fine. It is not a particularly painful procedure. We do a lot of breast reduction on teenagers who are kids, and they only take the pain pills for a few days, and so do the adults. We send everybody home with a week-long prescription for pain pills, and no one hardly ever asks for a refill. I think this is well tolerated, and there is no real special care. Everything is going to be closed. The incisions are dissolvable. They're going to fall off by themselves. You don't need to put antibiotic creams or anything on them. And we will see you along the recovery so we can guide you through every step of it. Thank you for choosing Ideal Plastic Surgery for your breast reduction. We are the team with the most experience, and therefore I am confident we're going to be able to give you the best possible results. Thank you.